Good afternoon, ladies and gentlemen. My name is Waleed. Before I start my presentation, I would like to thank Sarah to give me this opportunity to present my topic that I have chosen in front of the lovely audience. My presentation will be about the HIV/AIDS statistic and treatment. I'm going to focus on the last research that have done for the treatment that they get for the HIV and AIDS. So, let's start my presentation. The first slide, I will briefly describe the HIV or AIDS. Maybe some of you know or have read or have watched the video about HIV and AIDS, but I'm gonna just give you some information before I give you like which the scientists found for the cure. First of all, that the disease was discovered in early 1980s. And the problem of HIV and AIDS is attack the immune system. What does that mean? That means when the disease destroys the immune cells in our bodies, we won't have have the ability to avoid or protect ourselves from the other from colds or any illnesses that we will get in the future. It means we will die. Now I'm gonna move to the second slide, the possibility of the functional cure. The result of a study released in 2012, the scientists get 14 people from France to do the study. After 3 years, they got a new cure. It's called ARVS, okay, and it's predict the people or they stopped taking after three years. Then they got live for with the low levels of virus in their system for an average of 7 years. It means they will live longer than before when they got the ARVS cure. Second, there's another study also. The result of a study released in 2014, just last year. It's a 9-month-old baby born in California with HIV. In the first 48 hours when the baby was born, they gave him the same cure. The HIV and AIDS was disappeared from his body. This is why they are working on it to develop it for the adults. It works for the baby now, but it won't work until now like for the adults. The same study, they found it in 2 years ago in March 2013, announced that the Mississippi baby born with the HIV. The same thing, the same idea with the baby who was born in California. They used the same cure and it works for the babies. This is why now they are going to develop the same treatment, but they are going to try it for the adults. Because the babies now maybe they will be okay, but the adults until now they couldn't find. Now I'm going to move to the second slide. It's the intertrivial therapy. It's helped leave the person longer, lower your risk of developing the HIV/AIDS in the body, also reduce the changes you will transmit HIV to others. But this treatment or therapy, it won't be work just by itself. There's 5 things you have to do it. First of all, you have to have a diet, from a doctor who special for a diet or a food, and you have to daily exercise, avoid alcohol, tobacco, or smoking, plenty of rest, and also regular checkups in the medical cares. Now I'm going to move the second slide. It shows you the map. Where is the most popular in HIV and AIDS. As you see, maybe it's light blue here and around the world, but the most darker and blue it's in Africa. Maybe that will be a little bit confusing for some people, but in the next slide we will know why the AIDS is the worst in Africa. As you can see, there is 75 countries less than 1%, and there is also 29 countries between 1 to 5%. Also, there is 3 countries between 5 to 10%, and there is 9 countries more than 10%. and all the countries almost the dangerous, I mean in HIV and popular with AIDS, it's in Africa. Now I'm going to move and I'm going to explain to you in the next slide why is AIDS worse in Africa. There's 5 things that according to FCN in 2004, February 5. More sexual partners in Africa, more than in any country in the world. And also the tradition of polygamy that's related to the maybe traditional in Africa and some religions. And the third point is tolerance of promiscuous behavior. Also the prostitution. Prostitutes have more than 100 partners in just 1 year. And using drugs. What I mean using drugs, maybe you, as you know, we use the drugs around the world, maybe not all of the people, but the problem here in Africa, the needles. For example, if I have a disease and I use the drugs, and maybe I give it to another person, and then the disease is transferred from my body to his body. This is why that get a long story with Africa, and they maybe almost 35 million. And now in the next slide, this is the global statistics about how many people around the world who have HIV. I have 2 circles or that shows you there is how many people around the world and how many people who have HIV. I'm gonna explain to you now. There are 7,600,000,000 people around the world, but there is just 100% who have HIV. It means 35 million people around the world who have HIV. From the 35 million, there are 3,200,000 they are children who have HIV. This circle shows you the children, and this is the number of the people around the world, and this is the number who are normal. They don't have HIV or AIDS. Now in the second slide, it shows you also the map, but shows you how many people around the world. There are in 250,000 in Caribbean, and also 2.3 million in North America and Western and Central Europe. In Asia and the Pacific, 4.8 million, and the least number in the Middle East and the North Africa, but the most or the highest number in Sub-Saharan Africa, 24.7 million. Now in the second slide, there are the HIV/AIDS from 1990 to 2012. Like as you see, when it started in 1990, it was just maybe 7 million people around the world. But as you can see, it started to increase a little bit in each year. Like from 1990 it was 7, 1991 it's become 10, and then increased in each year until it started in 2006. It stopped in 29 million, and let's continue in the same way. And in 2009 it started decrease, but also after that it increased, and until we got in 2012 it's almost 35 million people around the world. Now this is the reference that I've got the information from, and thank you for listening. That's all that I have that's all the time that I have. Thank you so much. If you have any question, it's my pleasure to answer it.
I have a question.
Yep. Yes, please.
So, what's your prediction about how long does the scientists could find a new treatment of the AIDS?
Well, that's hard to answer. It depends about the scientist. It's because it's not like a disease we can get it and we study about it. No, the problem is the disease affects the immune system. It's like a cancer. It's from something inside the body. Even when you use the treatment, it affects you. Even if it helps the treatment or the cure, help the body, also it have a negative effect for the body. Because some doctors, they give drugs for people just because they want them to to the person who has it to feel less pain. That's also, as you say, as you know, like drugs is not good for the body. That's why it's sometimes maybe it took a long time. Until now they found it for a baby, but for adults, I don't know. They didn't find until now. There is any question? Yes, please.
You said HIV and AIDS is the same word?
Well, that's a good question. Thank you so much. I'm gonna explain it now. HIV is a virus. Some people have HIV, but doesn't mean they have AIDS. But if you have AIDS, for sure you have HIV. Why? Because HIV is a virus, but the AIDS is that like what we feel, like what's the symptoms that we got from HIV. That's what we call it AIDS. There are many people are living now with the HIV, but they don't have AIDS.
So, can we say people get AIDS caused by they have HIV?
What do you mean? Can you clarify, please?
You mean some people who have HIV,
Yeah.
It doesn't mean they could have AIDS.
Yeah, it doesn't mean they have AIDS.
Yeah.
Doesn't mean, maybe it's a little bit confusing, but the HIV it's the same. It's a virus. But we got after that, maybe the people who have both HIV and the AIDS, they are worse than the people who have just the HIV, because the people who have HIV maybe they can live longer.
So could HIV can transmit to other people?
Yeah, the same thing. It's because of the virus. The virus will affect the body, but
by what way? Touch or?
No, it's not touch. It's by blood or by sex, by if the person, yeah. And yeah, the same way. It's also like for the children, like they can get the AIDS by breastfeeding. Just imagine maybe there is a child, okay, his mother died, and like there is another mother who give him breastfeeding. He will get the HIV from her. That's for the children, and as I said before, for the needles, if you're using drugs, or even if you did the check in the medical or in the hospital, and they didn't clean the needles, maybe you'll get the HIV. Is there any question or no? Thank you so much.